Hi, Dr. Martin Rutherford here at Power Health, and today we're going to be talking about cholecystectomies, or what you might refer to as having my gallbladder out. I'm on an ectomy kick right now. We just did a thyroidectomy. We're going to do cholecystectomy today. We're going to do hysterectomies. We're going to go the ectomy route here for a little while because people are just coming in here with organs missing like crazy. When I first started doing chronic conditions, and I started with fibromyalgia and peripheral neuropathy and chronic fatigue. And this was when we didn't know what we know now. If a patient came in and their gallbladder was missing, and their appendix was missing, and their uterus was missing, and their thyroid was missing, and their tonsils were missing, or some combination of that, we would just automatically assume that the person had an autoimmune problem, because all those organs are not meant to be missing. They all kind of have a function. The whole system works together. And when I was a kid, it was tonsillectomies. Everybody's getting their tonsils out all the time. Everybody's getting them out. You know, you went to the hospital. You couldn't wait to go because you knew afterwards you're going to get tons of ice cream. You're going to miss school for a day or two. And people were going to be nice to you and give you a little gift. And it was an exciting time in your young life. And now we're finding out that wasn't such a great idea to take out everybody's thyroid. We found that it's not a great idea to take out everybody's appendix. And for those of you who don't know that, we'll do one on that too. And it's definitely not a great idea to take out somebody's gallbladder. So people come in here with the gallbladder all the time, missing, cholecystectomy. And I ask, what happened? Well, I had this pain, and I had pain here, and then I had the pain in my mid-back. And so they looked in there, and they saw I had some gallstones, and they saw I was inflamed, and they saw that, and they said, let's just take it out. Just take it out. It doesn't do anything. I'm not sure if you've heard that, but gallbladders do not do anything. Okay, gallbladders are significantly important to your overall health. And yeah, it's interesting. I went to a huge symposium on gastrointestinal diagnosis and treatment just about 5 weeks ago, and it was and of the 50 things that can go wrong with your digestive system from the time you put food in your mouth till the time that food hits the water in the toilet bowl, okay, they probably devoted the most time to discussing the gallbladder, which kind of blew me away. I mean, I had already understood the gallbladder was important, but it really put it in perspective relative. I mean, they spent more time talking about the gallbladder than they talked about ulcerative colitis or Crohn's disease or any of these severe autoimmune problems that attack the intestines. So the gallbladder is not a throwaway item, and that's how it's been presented for so many years. And to assess your gallbladder, usually there'll be a blood test, and they'll do something called they don't. If they want to assess your gallbladder, they'll do something called an ejection fraction. So what's the gallbladder? The gallbladder is a sac that is a reservoir that holds bile. Bile comes from your liver. Your liver is the big detox center of the body. And so a lot of the toxins are in that bile. The bile is in the gallbladder. All this is in the gallbladder. And then what happens with the gallbladder is when food hits your stomach, and the acid, the hydrochloric acid in your stomach, that acid that helps to digest food, particularly your proteins, when it starts digesting the proteins, it sends a signal to your gallbladder. It's a hormone called cholecystectomy. Chole means gallbladder, okay? Cholecystectomy hits your gallbladder, and your gallbladder starts ejecting the bile out of there into this duct that ultimately goes into the intestines. And most of you may be familiar with the fact that your gallbladder is there to digest fats. So the theory is we'll just take it out, and if you can't digest fats, we'll give you these medications that will sequester the fats, and they're called bile sequestration medications. And then they'll just scoop the fat up and they'll take it into the toilet. That's highly simplistic, and it's not exactly the way that a gallbladder should be attended to. So basically, we'll go back to how the gallbladder is measured. They'll measure the ejection fraction of the gall. They'll measure how strongly it ejects the bile into your intestines, and that's it. If there's any problems with pain, that's not good, then they'll do an ultrasound, and then they'll look at it and they'll say, there's small stones, there's medium stones, there's large stones, there's sludge in it. You know what? You don't really need your gallbladder. Why don't we just take it out? It's causing that pain. We'll take it out. The pain will be gone. Problem is, a lot of people get the gallbladder out, pain doesn't go, because there's a lot of people out there that aren't very good at diagnosis today, and so they counted on those stones being the problem. So for one, a lot of times you get your gallbladder taken out, and it's not the problem. And now you're missing a gallbladder. Well, it's no big deal because it just digests my fats. I can take these medications. Wrong. Okay, first of all, let's go. So first of all, the gallbladder, when it's taken out, there is a duct that I mentioned that the bile goes through before it gets into your intestines. That duct now becomes your new gallbladder. And it tries to do the job of the gallbladder, and frequently it can't. It's a little overloaded, and the sludge builds up in there. You start getting your gallbladder symptoms again, and you start thinking, what the heck, I just had my gallbladder out. So the gallbladder should be left in under all circumstances unless it's gangrenous. There is substantial evidence that you can use. Now, you can use bile salts. Those are pretty aggressive. You can use bile salts to get your gallbladder going. You can use a lot of different, there's different herbs and botanicals. I forget what all of them are. I use a product called Bile Min. It's from a certain company that I use, Apex Supplements, a company. And it has a number of herbs and botanicals that break down the sludge, they break down the stones. Now, there are a lot of studies out there. This is not a quack type of thing. This is not an alternative, hooey gooey type of thing. There are a lot of legitimate studies out there that show that these bile salts and these herbs and botanicals will break down those stones. They'll break down small stones for sure. They'll break down medium stones. And to a large degree, they'll break down large stones. Now, occasionally, you'll get a large stone that'll get stuck in the bile duct, and then you kind of have to get it out. Okay, but they can do that by blowing it out with lasers. And so really, once the gallbladder is sick, if it's sick for a long time and it actually becomes gangrenous, that is, in my opinion, the only time that my gallbladder is going to disappear, okay? Because that now becomes a massive infection that can break through, go into what's called your peritoneum, and you can get sick and die, okay? But that's not often the case. In fact, it is rarely the case. So gallbladders can also be reconstituted through, believe it or not, exercise. Exercise causes the gallbladder to eject better. Diet, you could start on a low-fat diet. What's a sign that what are some signs that you have a gallbladder problem? One of them is going to be that you're avoiding eating fried foods. You're avoiding eating fatty foods. You just start to realize that when I eat these foods, things aren't going too well. I'm getting gas, I'm getting bloating, things of that nature. I'm not breaking down my feces. My feces is floating. You can get itchy skin. There's a number of things, a number of other symptoms. So you can avoid fats. Another thing is I take fish oils and I burp them up. You can just avoid fats. You get exercise. There are a lot of medications that actually cause the gallbladder to not do so well. Among them, statin drugs are high on the list. Statin drugs affect the muscle structure there and the ejection fraction. Antibiotics will affect that. If you have something called small intestinal bacterial overgrowth, or you have an imbalance in bacteria in your intestines called dysbiosis, that will affect your gallbladder. Stress will cause your gallbladder to not eject properly, because if you're in chronic stress and you're in chronic fight flight, that shuts down your intestines, and so that, because you don't have to be like peeing or pooping while you're fighting or fleeing, that also shuts down your stomach. It also decreases gallbladder function. Probably the number one cause of gallbladders being dysfunctional, low thyroid function. If you have hypothyroidism, that'll slow down the ejection fraction. So these are all the things that we see in our type of a practice. Patients will come in, their gallbladder is missing, they think it's okay. We actually have to go back and work with that gallbladder, because to go back to the statement of, we'll just take your gallbladder out, it's just a sac, you don't really need it. The gallbladder now is known to do a lot of things, okay? They know that it does more than just digest your fat. It actually has an effect on your blood sugar. It actually has an effect on your immune system. It does put out anti-inflammatory enzymes that help to keep the inflammation down in your intestines, and there's so much more. So the focus on the intestines is huge now in the research world, and the gallbladder is starting to gain a little bit more respect than it has had in my lifetime, and it should have that respect if you're watching this and your understanding of it. So cholecystectomies, they can be valuable in certain situations, but a lot more gallbladders come flying out of these bodies today in this country than should be, and hopefully this gives you a little bit more rounded data as to how to maybe look into that, kind of evaluate whether somebody's talking to you about getting your gallbladder out, and you listen to this and go, you know what, I have hypothyroid, and the medication doesn't seem to be working, or you know what, I've been in chronic stress for like my whole life or for a long time, or something along the nature of those parameters, or also something along the line of maybe a second opinion on, hey, I got stones, they said they got to come out. There's nothing that can be done for them. The research just doesn't agree with that at this point in time, and I have numerous research papers I could share with you if it's something that you wanted to contact us on and have the actual data. So cholecystectomies, check them out, do a little research. You have gangrene, you have a gangrenous gallbladder, get it out of there. But beyond that, you really need to start looking for the other causes of it, and most of those other causes have solutions, and the vast majority of them are actually drug-free solutions, and they're consistently successful. For us to get a gut better and keep it better, if that person doesn't have a gallbladder, or they have a gallbladder that's not functioning well, we have to get that thing functioning normally, and we're usually pretty successful at that. So it can be done. All right, so that's cholecystectomies. Until next time, Dr. Rutherford, I hope you enjoyed that. Let me know if you have any other interesting topics that you'd like me to review, and I'll be happy to try to accommodate you. Take care.